Hey, it's Debbie Potts, and I am talking about hormones for men and women today. I know a lot of people have been diving into peri and postmenopause, and it's really important topic to discuss, but I feel that we're leaving out the men. So today I'm going to make sure my guest, Dr. Janette Gray, that is local to me in San Diego, is going to address changes for men and women as we age. So let's dive into hormones, how things change as we age, and figuring out strategies, what you can do today in middle age to be your best self in the future. So I'm all about taking ownership of our health now. So when we are retired, we're supposed to be enjoying life. Hopefully, you're enjoying life today, but even more, living your best life at the end of your life, right? So I feel that we need to do everything we can do now, starting age 40. But for sure, when you're 50, I hope you're starting to think about, ooh, am I doing everything I can do today to improve how I age, quality of life? So, we're going to talk about hormones and whatever else comes up in our conversation, but really looking at what Dr. Gray has found. She has a program and a book. We're going to talk about the perfect balance health and talk about how hormones impact everything from your metabolism, energy, mood, muscle, sleep, and of course, sexual health. And she's drawing from decades of clinical experience in internal and integrative medicine. And Dr. Gray specializes in helping men and women achieve vibrant health and longevity. She does work with personalized programs using bioidentical hormone replacement therapy and lifestyle medicine, right? So I look forward to diving into this talk. Let me know your questions in the notes below or in the comment section, and we will follow up. So let's learn something about what we can do, why you might experience chronic fatigue, unexplained weight gain, low libido, and you just feel that I'm getting older, that's what's going to happen. Well, let's look at strategies, solutions, what you can do today to be your best self and not have that happen. Don't accept it as your new normal. All right. Okay, I have Dr. Janette Gray to talk about how we can improve the aging process for men and women. So, thank you to come on the show and talk about the perfect balance health. Welcome.
Thank you. Thank you. It's good to be here. I appreciate you having me on.
Well, tell us a little bit about your transition, your background, and what is perfect balance health as we dive into
Yeah,
improving our
well,
future self.
basically, I've been an internal medicine doctor for 30 years, and I had a practice for 25 years integrated with that emphasized integrative medicine and bioidentical hormone therapies for men and women. And I retired about 2.5 years ago. And after retiring, I started playing pickleball a lot and meeting a lot of different people and hearing lots of stories. And one recurring theme was that they were oftentimes not being listened to by their medical providers. They would say,
Hmm.
I've gained weight, my libido's down, my energy's down, I'm not able to sustain or gain muscle like I used to. And they're just being told this is normal aging, accept it. There's nothing more that we can do. Your labs look normal, etc. And I just felt like, you know what, this game isn't over yet. I need to get back in, and I need to start helping people with this issue. And so I started Perfect Balance Health and wrote the book The Truth About Sex Hormones. And my hope is just to touch as many people's lives as I can and hopefully make their quality of life better and some more longevity thrown in as well, and good quality of life as we age.
What do you find the biggest number one theme that you see from people as you met with pickleball that are their signs and symptoms, what they're struggling with? What are the
Yeah, the
top
weight
ones?
gain, feeling
Weight gain.
fatigue, loss of vitality, their stamina is not the same. They just say, I don't have that zest I used to have is very common. But what
Hmm.
happens with women in menopause, the hormone drop tends to be more precipitous, more sudden, kind of like going off a cliff when you hit menopause. With men, it tends to be more gradual. So it's not uncommon, especially in men and women, but more with men, that the symptoms creep up. They gain 5, 10 pounds a year or so, and before they know it, they're 30, 40 pounds overweight, their libido's down, they're having troubles with erections, they just aren't as vital as they used to be. And sometimes if you don't ask them, they don't even realize it. Or maybe the wife or the partner says, honey, you're not yourself. And that happens with women as well, but with men, it's more gradual.
Do you find that people are less resilient as they get older? Chronic stress, they're not able to handle the load.
I mean, you could look at it that way, certainly. I mean, it depends. That's why in my book I talk about, the health and wellness book, and it has 8 sections. And one
Mm-hmm.
section is hormone replacement therapy, but all the other sections are nutrition, exercise, sleep, stress management, mental
Mm-hmm.
health, and going to the medical doctor to rule out diseases and screen for diseases like hypertension and high cholesterol and heart disease and osteoporosis. So all of that together is about resilience, right? And if you're
Mm-hmm.
addressing all those areas of the wheel, then the hormone replacement therapy comes in and is just sort of the icing on the cake.
Mm-hmm. Yeah, so you're really looking at investigating what's actually going on with them to feel those symptoms that it doesn't seem often just the hormones. Is more, yes, the hormones get lower as we age, but what can we do about it to continue to thrive and regain
Right,
our vibrant self again, and not just,
right.
I think what I'm getting to is I think a lot of people think if I just take these hormones, I'm going to be myself
Hmm.
again. And I feel that it's
Right.
more what you and I have talked about, that holistic approach that isn't just, take this for that. We still need to address how are your systems working, and as you talked about
Sure, of
nutrition and
course,
exercise
right.
and all of that. But do you find people have low hormones when you get started with them, when you start working with new clients?
Yeah, well, there is a little bit of the chicken and the egg story, where maybe let's take a man who's in his mid 50s and his testosterone has been gradually going down, and now he finds himself with low energy, not going to the gym because it takes too much work, and muscle mass is down, and he's gained weight and all of that.
Mhm.
And it's sort of like trying to get a rock moving, the
Mhm.
inertia is hard. So in that case, sometimes starting the testosterone gives him a little zip, a little more energy, maybe the sleep and the mood improve. Then he can start going back to the gym. Now he's getting more energy because he's working out more, and now he's more motivated to eat better. So sometimes it starts with that. And other times it's, no, I'm doing everything right, and I'm still not where I want to be as vital and, feeling my best.
So, what's a new approach as you came out of retirement and open up your new practice and calling it Perfect Balance Health? How are you taking a different approach, or I assume you are taking a different approach than
Yes.
before,
Yeah,
looking at
well,
different
before it
lens?
was a primary care practice that
Mhm.
emphasized integrative medicine and bioidentical hormones. And with that, and we took insurance, and with that comes all, the challenges of running a practice, and all the stress that comes with getting referrals and prior authorizations and billing insurance. So I don't do any of that now, and I'm able to keep my prices low and offer it to as many people as possible. And I have more bandwidth. We say it's unlimited consultations. If you need to call and talk, here at, every week, I have the bandwidth for it. Before I didn't have the bandwidth. So we're
Yeah.
very focused on weight loss and hormones.
So when you have a new patient coming in, they're struggling with unexplained weight gain, they have this fatigue, they can't recover from workouts. What's your approach to helping these people feel better?
Well, after, a thorough history and trying to determine what areas there may be other deficits so that we can get to the root cause, I like to get lab tests done. And the lab tests look at sex hormones, estrogen,
Mm-hmm.
progesterone, testosterone, as well as thyroid thoroughly, and a CBC chemistry and cholesterol and diabetic markers. So I want to know, one, do they have pre-existing conditions that need to be addressed not only with hormones but with lifestyle? But then you
Mm-hmm.
also have to rule out conditions that could mask as perimenopause, menopause, or andropause. You don't want to be saying, "Oh, your fatigue is because your testosterone's low," but maybe their thyroid is down. So
Mm.
it's a finely tuned machine. It's like an
Yeah.
orchestra. It has to all
Yeah.
be in tune.
Well, I see that every episode, I think, is that we have to create
Yeah.
that metabolic harmony and avoid this metabolic chaos, as we say as
Yes.
practitioners. But it's really looking at, I think so much information is out there on hormone replacement. And I just feel that people are just taking it as a band-aid and
Yeah.
not working on the whole person, as you
Yeah.
and I have
No,
talked about that.
absolutely.
Do you find
Hmm.
that people just want, give me those hormones and not do the rest of the work?
Yeah, that and weight loss. People are going in these telemedicine, you know, mills where they don't even talk to a person.
Yeah.
They do a questionnaire, no labs, and they're prescribed a medication for weight loss or their hormones. And
Mhm.
I just don't think that's good medicine.
Well, the GLP-1 weight loss drugs, I saw something on TV today and they're talking about some new drug and popped up on their blood pressure and cholesterol. And one said, "Kate, that's deeper insight that that's giving you. It's not the number, a symptom result of, it's just looking at the whole root causes, how the body works
Yes.
together." And it's interesting how many people feel that they just take the testosterone. I mean, I know it helps, but what other things do people need to do if they're struggling with weight gain, if their testosterone and estrogen, progesterone, men and women, we can dive into separately. But what else do you feel is makes a big shift in combination of hormone replacement?
Yeah, well, one is making sure you are testing for the right hormone and
Mm,
that you're looking at the levels in an individual personalized manner. In other words, one size doesn't fit all, and normal is not necessarily optimal. So
yeah.
those are two concepts, right? Or really three, because you have to get the right lab test, you have to interpret it properly and in reference to the individual. So when you've done that and then your numbers are all where you want them to be, what else can you do? Then, of course, for weight loss, we're looking at exercise, strength training, or resistance training specifically, getting that area of the wheel as good as possible. And that's where you come in. I can send somebody to you and say, okay, I want to get a VO2 max. I want to see what your metabolic flexibility is. How is that section of the wheel? Have we maximized that? And then of
Mm,
course, so exercise, nutrition, you come in there too. Are they eating enough protein? 0.7 to 1 gram is kind of a going number per pound of ideal weight, daily. And a
yeah,
lot of people are not getting enough protein, right?
at
So
all.
how can
Yeah.
you build a muscle with testosterone if you don't get the right nutrients? And if you don't build a muscle, you're not going to get a higher metabolism. So then the weight that you maybe lost, you gain right back. So
Yeah.
it's all interrelated. And then the thyroid, of course, should be optimized because you want your metabolism functioning at its optimal best, not struggling just because it's normal, but it's at the very
Mm,
low end of normal. And then are you sleeping well, right? I mean, so critical and so underappreciated. And your stress levels, like you said, are you dealing with cortisol levels that are off the charts? Are you, mood, depression,
mm.
anxiety that causes stress, that causes you to not sleep well, and it's a vicious cycle. So it's addressing all those areas.
Yeah. I just so love what you do because it's so important to preserve the muscle and to speed up the metabolism. And I think so many people aren't looking at the whole picture, especially if they're trying to do the
Mhm.
weight loss. And it gets very
Right.
confusing, and people want the quick fix, take a medication to drop that weight, but they don't understand what's going to happen in the future is probably slowing that metabolism down and breaking down muscle when we're all about how to build muscle or at least not lose it as you age,
Right. Well, because
sarcopenia.
they take these drugs and they block your appetite, which is great, but then they go, "Oh, I'm going to lose more weight by just not eating." Well, then you
Yeah.
lose muscle and fat. And then when
Mhm.
you start back eating a little more normally, your metabolism is now lower, so you gain
Mhm.
it right back. You've not made
Mhm.
you have to make changes in lifestyle and habits for sure.
So, what are some hormone markers that you like to test for some? You mentioned some of them, but like free testosterone, total testosterone, give us kind of an idea and
Yeah, with
ideally
test
not.
Yeah, with
The,
testosterone, I like to do calculated free testosterone.
mm,
And that I put into a calculation that takes into account albumin and sex hormone binding globulin. And the reason that's critical is because when you check testosterone levels, total testosterone, it's looking at all the testosterone that's floating around in the blood, which is the that testosterone which is free, and then that which is bound loosely to albumin and more strongly to the sex hormone binding globulin. So the only hormone that's really bioavailable or available to the cells is the free level, the free testosterone. So by doing that calculation, I often see people who are told again, that their testosterone levels are normal, but in fact, their calculated free testosterone is not in an optimal range. So that's what I
mhm,
mean by knowing what to check and then personalizing it to the individual.
mhm,
And then progesterone and estrogen we check as well. And even in men, we check estrogen because testosterone can convert to estrogen, and we don't want too much estrogen going, too high in men. Although it's not bad to have a little higher estrogen, but we do watch that because we don't want side effects. And then
mhm,
in women, we check estrogen, progesterone, and testosterone. If they're in perimenopause, that becomes a little bit more challenging to really interpret those numbers, especially the estrogen and the progesterone. But we do look for ratios. If the ratio is showing that progesterone is starting to come down and your estrogen dominant, that's
mhm,
one, we'll have one approach. And if you're
mhm,
menopausal and you have no hormones, well, that's a different approach. So
mhm.
it varies from person to person. It really is very individual.
Do you find the blood serum test and combined with the Dutch test as best results, or what? Isn't that
I
what you do?
find the blood test works and it's consistent and
Mm,
reliable. I don't do the Dutch test. Um, I'm familiar with it. I've used it, but I don't find it that adds that much more to what I'm doing in terms of
mm,
balancing those hormones.
okay. And do you find it effective to work on other labs, like look at their liver detox pathways if they're congested and their
Yeah,
GI, beta
I do
glucuronidase?
the basic labs like the liver function tests, ALK
Mm,
phos, the kidney, but I'm not when we get to that level of getting the diet and the metabolic pathways and all
mm.
that going, I hand them over to you. I'm not trying to be something to everybody. I
Yeah.
try to stay in my lane.
That's what I keep saying is just, do what you do best. We're just saying hire the rest. Do what you do best is what I learned in
I
college.
Yeah, no,
And
absolutely. I don't,
do,
and I'm not as an expert in it as you are in some of those metabolic pathways and detox pathways. I
yeah.
appreciate it, and I send
Hmm.
people, to different people to work on those sections of the wheel,
Hmm.
basically.
Yeah. So let's talk about your book. Talk about what it's about, why you wrote
Yeah, well, let me show you here the
it.
pretty little cover. I don't know if you can see it there.
Yeah, the truth about
Yeah,
sex
there it
hormones.
is. Well, it really, again, after retiring and playing pickleball and hearing all these stories, I found myself repeating myself a lot
Mm,
and realizing that, it would be best to put it on paper and put it in a form that I can give it to patients and say, okay, this is the philosophy, this is why we're doing what we're doing, and help educate people. And it
hmm.
really focuses on bioidentical hormone therapy for men and women in the construct of this health and wellness wheel as it lends itself to longevity and quality of life.
Yes, I appreciate that again because I I feel like for going back to labs of thyroid testing, I
Yeah.
taken thyroid and a lot of people thyroid medication and doesn't really solve why is your thyroid low and looking at the whole
Hmm.
picture as you're doing the
Right.
perfect balance health of getting everybody creating that metabolic harmony so all the players create
Hmm.
the music as they're singing the orchestra.
Yeah.
But the hormone balancing is something you just don't do on your own. You need to work with an expert of yourself to create the right amount
Well, I
of
mean,
Goldilocks for
yeah, if
everything.
you don't test it, you're guessing, right? And
Hmm.
so I think we want more data points to be able to have a more complete picture of what's going on. History says a lot,
Yes.
signs and
Hmm.
symptoms say a lot, then we get the labs and other testing that is done, and you get a more complete picture of what's going on. And then with these biomarkers, you can make goals, you can recheck and see how you're
Mhm.
doing. So it really allows you to make a plan and then see how you're doing.
Yeah, because I think a lot of people see different supplements online to think, oh, this
Mhm.
will boost my testosterone and this will help me, or
Right.
I'll take these peptides. But it's not always addressing what your hormones might need a little different approach to improve.
Well, I mean, supplements, for instance, let's take supplements for menopause symptoms or perimenopause symptoms. There's some great supplements like black cohosh, dong quai, vitex, licorice that help with some of the symptoms of perimenopause and menopause. But what they don't address are the chronic diseases that the hormones can potentially prevent, like osteoporosis, heart disease, Alzheimer's, cancers. So, when I'm looking at somebody, I'm not just looking at signs and symptoms. I'm also looking at, are we able to start hormones that might change the trajectory of their health in the long run?
So going to women specifically, then we'll go back to men, but what do you feel that estrogen, progesterone, hormones people should be looking at as they're entering this perimenopause phase for the hit menopause, which is I always think funny, one day in time that we haven't had our cycle for 12 months. And then the next day we're in postmenopause. So what do people, what
Right.
should they be thinking about?
But the challenge with that, as you know, is probably 30% of women don't have a period, maybe because they got an IUD or they had
Mm,
ablation or they had hysterectomy. So you can't use necessarily menopause or not menstruating for a year as your only sign
mhm.
of perimenopause, menopause. And that's where the labs come in often and symptoms.
Yeah.
But in terms of, what to treat, with women, the estrogen is a very dominant hormone, and they have found that, women that are on estrogen have 2 times less chance of getting Alzheimer's. They might have 40 to 50% chance fewer fatal MIs, heart
Mm.
disease, cancers. It really does a lot. And progesterone helps, with bone and balancing the estrogen. And then there's the testosterone. What is your quality of life? Are you getting the muscle and bone density that you need? So they kind of all work together.
So if someone's reaching that stage that they know they're perimenopause, if it's
Mhm.
5 years before, 10 years, should they start seeing someone as yourself to get on estrogen before they hit menopause?
Yeah, well, that's where one is starting earlier, where we can still, intervene in a timely manner, is exactly right. The other is getting those lab tests, because if a woman's in perimenopause and she's still making quite a bit of estrogen based on the lab test, I might just start her on progesterone because it has a calming, sedating, balancing quality to it, and maybe not start the estrogen right away. So
Mhm.
it really is, again, individual.
I find that interesting when I get new clients that so many are not on progesterone, they're just taking estrogen. So I'm always wondering, okay, are you working with someone to keep those in balance and not have estrogen
Well, if
dominance?
you have a uterus, you have to be on progesterone, because if without progesterone, the endometrium or the lining of the uterus can build up and lead to uterine cancer. So that's the one reason you have to. But there's most doctors that are trained in menopause, which aren't very many these days, and that we can get into that issue. But they go, oh, you don't need progesterone unless you have a uterus. And that's not necessarily true. It is a
Mm,
balancing hormone. It's a
mhm.
feel good hormone, and a lot of people feel good on it, even if they technically don't need it for the uterine lining.
Yeah, because I know some ladies I saw they're in their 60s, they're postmenopause and they're on estrogen, but no progesterone.
Well, that if they have a uterus, that's risky.
Mm. So, what kind of goes with that biggest myth or fear around estrogen that you often have to course correct for people or mythbuster?
Yeah. Well, the obvious one is doesn't it cause breast cancer? And
Yeah.
unfortunately, a study called the Women's Health Initiative from 23 years ago set the stage for everybody to suddenly overnight basically stop prescribing and stop taking estrogen in particular. But along with that came the progesterone and the testosterone. So the whole kit and caboodle, as they say, went away. And it's
Mhm.
been taken 23 years to reanalyze the data, follow that cohort of patients for these last 20 years, have new studies come out to show that estrogen does not cause breast cancer and, in fact, does a lot of really great things. So now we have a generation of doctors who have not been trained in women's medicine or menopause for that matter. And we have 2 decades plus of women that have not been treated with hormones. And so you have the Gen X and the Gen Z saying, hey, we want to get what we should be getting and would benefit most from.
Mhm. So when is it too late to start estrogen? Is there a certain age that like, oh, you've been in menopause too long?
There is something called the timing hypothesis, and it has been found that if you take estrogen in particular within 10 years of menopause, or from menopause on, that you get the most out of it. There's no doubt. The decrease in coronary artery disease, the benefit in the bones, the benefit in preventing Alzheimer's and cancers is definitely best if done in the first 10 years. But there's still a lot of benefit with estrogen, especially after 60, whether it's your skin, your bones, just a vaginal dryness and pain with intercourse, and that can be a vaginal cream, but it can also be a transdermal or even oral. So it's not again, it's one size fits all. What are your symptoms and signs? What are you dealing with? And what are the benefits and are there any risks at starting at an older age? But I would say every age you can evaluate somebody for possible hormone replacement.
Hmm. And for men, they often get some, I'm sure, common to hear low testosterone in men. And what do you feel the signs and symptoms for men that they need to maybe look into getting some support with testosterone?
Yeah, and like I mentioned, because it is kind of gradual for them, oftentimes they're already, 30, 40 pounds overweight, fatigue, not going to the gym, low libido, maybe having troubles with erections, even irritable, not sleeping. All of those symptoms can be related to testosterone. And the question is, where's that threshold, where you start seeing the signs and the symptoms? I like to check it when men are in their, low to mid 40s to see where
Hmm.
are they and then track it so that if the trend is down, because testosterone in men peaks between 20 and 30 years of age. So it's starting to go down. The
Yeah.
question is how high did you start at and how fast is it going down? And at what point are you symptomatic? But why wait until you're symptomatic and already having some of the long-term problems of low testosterone, like heart disease, before you intervene?
And I think a lot of times men need to look at their mood and their energy, their fitness, that it's not just here, this pill's going to fix everything.
Right.
Because
No,
as you
absolutely.
said, they're less active, maybe they're not eating right. So it is addressing all the foundations first.
Yeah. And that's why I mean, sometimes it's a combination because if they
Yeah.
are fatigued and
You
not
need, yeah,
motivated to go to the gym, maybe the
you need it.
testosterone will give them that boost that gets
Yeah.
them back, and then we get back on track. Yeah.
That makes sense because a lot of times people lack that motivation drive. I've known
Yeah.
other people have said that with for women for estrogen, progesterone, hormone replacement. Karen Mattel was
Right.
saying that you just say you just need to get started and then get that level up while we're working on your nutrition,
Right.
lifestyle, exercise.
Exactly.
Makes
So
sense. Yeah.
everybody's different, where their strengths are. And, I
Hmm.
had a lady that she was like 72 years of age, and she had been a widow for 10 years. Her husband had died of colon cancer, and she had met this guy on the pickleball court, and he invited her to go on a cruise. Well, she knew that he probably was going to want sex, and she hadn't had it in 10 years, and she had vaginal dryness and it was uncomfortable. And so I said, okay, well, we need to fast track this. I knew her labs would show no estrogen, no progesterone, and probably very little testosterone from her signs and symptoms. So I gave her a shot of estrogen and a shot of testosterone in the office and sent her home with vaginal estrogen and testosterone cream. And so by the third week, she was ready for her cruise and she had a good time. So you're never too old.
Oh, that's so cute.
Yeah.
So that's a kind of a good segue into the next question is when we're taking hormone replacement, you hear about the creams, the lotions, the
Yeah.
injectables, the patches,
Hmm. Hmm.
splits. What do you find is most effective for hormone replacement therapy?
Well, it depends on which hormone we're talking about. So for estrogen, it's correct. There can be transdermal, there can be oral, there can be even injection, which isn't used very often for
Mhm.
perimenopause and menopause. There are some studies with the bioidentical hormones in particular that the transdermal form may be the safest. There's
Mm.
some debate whether, again, it's a very low percentage of women that if they had a clotting issue or a thickening of the blood for some reason, that the oral estrogen could be problematic. So transdermal seems to be more popular for that reason. Um, but you can do oral, and many women do. Progesterone, on the other hand, you get I believe, the most benefit taking it orally because it gets metabolized through the liver in something called first pass, and it's metabolized into some different compounds, and one is a compound that's like Xanax. It's a GABA-like compound, and that gives the quality of relaxation,
Mhm.
sleepiness, and just a feel good um, benefit. So a lot of times I'll give a woman either transdermal estrogen and oral progesterone, and then
Mhm.
with testosterone that can be transdermal over the skin like a cream. It can be oral and it can be an injection. The injection does get the levels up the best and most consistently. The cream, some women have trouble with the, absorption, or it gets wiped off, or they don't put it on
Mhm.
properly, or they get hair somewhere and they don't like it. And then the oral, you got to take twice a day, every day, and that's a lot. So with the injection, it's once a week and you're done.
How many times is once a week that you have to do it? For how
Once
long?
a week. Oh,
Forever?
hormones, I like to give the example of insulin. It's a hormone, right? And you don't say, when are you going to stop your insulin, right?
Hmm.
So one can argue that your sex hormones are sort of the same way. If you want to continue living your best, feeling your strongest,
Hmm.
there's no reason to not continue them indefinitely as you do all the other things that you're working on.
But making sure for testosterone for women especially doesn't get too high. Do you have to keep
Well,
it in a
women take
range?
about a tenth the dose.
Hmm.
And that's why labs are so important, because
Hmm.
not only does it give you a baseline, but then you're able to track how are their levels doing? Are they in the optimal range and how are they feeling?
So how often do you need to do labs with clients?
It depends. Like 2 to 3 months is
Mm-hmm.
probably reasonable window when you make a change or an adjustment to get the hormones to kind of get to a cruising altitude and to have the patient have a chance to see the benefits from it.
Mm-hmm. And how do you see changes with the thyroid? As you mentioned, doing a full thyroid panel. What have you
Yeah.
found with that with clients with the
Yeah,
hormones?
very critical. And again, how does it mix with the environment? Their stress, their sleep, their obesity can affect thyroid hormones. Leptin gene affects thyroid hormone. So there's a lot of hormones that are affecting the thyroid, and then it's changing as you lose weight and get the other hormones balanced. You then have to see how the thyroid's doing.
Hmm. Do you find that you have to look at the full thyroid panel, not just
Oh, I
TSH? Do you look
always
at other markers?
Yeah, of course. Yeah. No, unfortunately that's what I was talking about with the testosterone. If you don't check the right level. That's where most doctors are trained to do TSH only, or medical providers. And the TSH, if it's, zero point 0.5 to, whatever it is, it depends on the reference range, 5.5, they say you're normal and there's nothing you need to do. But then if you drill down and you check free T4, free T3, some antibodies, you can say, oh, okay, it looks like it might be a Hashimoto's or an autoimmune condition. Let's work on that. Make sure we're dealing with those inflammatory markers and foods and all that.
Yeah.
At the same time, making sure that they're not having trouble converting the T4 to T3 or something like that. And I see that all the time. And people are told your thyroid's normal, your fatigue, your weight gain, all of that it's not that.
Yeah.
You must be eating too much and not sleeping enough and exercising. So it gets missed a lot.
And that's where I think investigating why is your thyroid low is so important for people to understand, working with a team that's going to help that integrative
Right.
approach, because the conversion of inactive T4 to active T3 is in your liver and also can happen in your
Exactly.
gut. And so if you have
Yes.
dysfunction in either areas, it's
Right.
going to
Mhm.
cause issues. So I know a lot of people get thyroid medication and just don't see any results because they're not addressing why is your thyroid low.
Yeah, exactly. But no, I
Mhm.
find the thyroid is critical to this whole puzzle. And even though I call the book The Truth About Sex Hormones, I do sneak in thyroid hormone for the truth.
So, what do you want people to learn from that book? What's your main mission?
It's a short book. It's an easy read. I have like, I don't know, 8 vignettes or stories of patients. So maybe they'll see somebody in there that they can relate to. Oh yeah, that's me. Sometimes that helps. And then the points that we've been making, that normal is not necessarily optimal. One size doesn't fit all.
Mhm.
And when your doctor tells you it's normal, you really need to be educated and your own best advocate to question, well, what does normal mean? What test did you order, and what reference range are you using, and do you know anything about menopause or hormone replacement therapy? And so those are the main take home messages.
Good. Yeah, I think that's super important to point out. And I say this a lot too, is that those reference ranges are ridiculous. A lot of times
Yeah,
they'll
I mean,
be,
what are they based on, right?
0 to 500 and you're a normal, right? So
Well,
it's not,
testosterone for women, 0 to 2 is normal for free
oh,
testosterone. So zero is normal. You're fine. You're 0.001.
and what,
Yeah.
what, what should women want in middle age for their
Well, for
testosterone?
calculated free testosterone,
Yeah,
optimal is 2 to 5.
two to
Those
five.
are the
Yeah.
ranges that seem to work. Now, again, we can always question, where do a reference range come from and all of that. And that's why it's a moving target. I might have
Hmm.
somebody outside of the reference zone, because they're feeling great, as long as it's not excessive where I'm worried that I'm doing, like thyroid, you can be too high, right? It can be
Hmm.
hypermetabolic. So you have to be careful.
How do you feel the role of DHEA and cortisol comes into play with this hormonal harmony?
Yeah, no, I mean, DHEA levels I check a lot as well. And those I like to see in the middle high range, that the adrenal is working. The cortisol, I don't do the saliva testing and that kind of stuff. Again, I sort of leave that
Yeah.
to you and to people that are drilling down a little bit more.
Mm. Yeah, because that's what's interesting. Sometimes order of operations, if you people look at a hormone steroid chart, one, it's made from cholesterol, your sex
Yeah,
hormones. So those people that
exactly.
still freak out about high cholesterol, which I get all the time, it's like, your cholesterol isn't to be too low or too high. It's the Goldilocks, and everybody has a purpose.
Yeah, and we also know that coronary artery disease is the number one killer of both men and women, at least after women get to 55 and aren't on hormones. So we do
Hmm.
have to look at LDL, ApoB,
Hmm.
LP little a, and I
Yeah.
always tell people to get a coronary calcium score to see,
Yeah.
okay, is plaque forming in your coronary arteries as a result of, you know, hyperinsulinemia, high LDL, so what's the river effects
Downstream.
of this? And let's look at the whole picture.
And I'm trying to read Dr. Nathan Bryan's book on nitric oxide, then the role of nitric oxide in all of this. It's
Mm,
just
right.
incredible. Because even
Yeah,
with
dilation.
estrogen, Yeah,
And that goes
estrogen.
down. That's thought to go down as estrogen goes down. So the dilation of the vessels go down. So then there's more clotting, and it's a inflammation. LDL goes up, insulin resistance goes up. So a lot of metabolic activities are going on just with estrogen going down.
Mhm. Yeah. So we look at the role of estrogen in the body for women specifically, and it's just, yeah, never learned that as it's growing up, that estrogen has so many different jobs just to
No, no,
deliver.
I think it's really come out a lot more in the last 10 years, and especially since the WHI, that Women's Health Initiative, where the data just didn't really make sense. And so there's been a lot of studies looking at that in particular.
Mhm. So when people are trying to preserve muscle metabolism as well as brain health, the cognitive health, how do hormones come into play here?
Yeah, well, again, estrogen is a key player with that. Women have a 2 times increased risk of Alzheimer's if they're not on hormones. They have, a 4 time greater risk of osteoporosis if they don't go on estrogen. In fact, 50% of menopausal women will have an osteoporotic fracture in their lifetime. And after that, about 20% of women die within a year of complications, and 80% of those women never regain the stamina and strength and vitality that they had before the bone fracture. So that's just one example where estrogen plays a critical role.
Mm-hmm.
And
It's
again, it's
crazy.
not the only thing, right?
Mm-hmm.
Exercise, vitamin D, calcium, magnesium, and all that, and your liver functioning properly and your microbiome. But, it's one of it's an essential piece of the equation, I believe.
So how do you approach hormone health for men versus women? Is there any differences?
Yeah. Well, we check testosterone and estradiol primarily in men. And again, it's back to that calculated free testosterone. And for men, it's more like, 20 to 25 is optimal. And so when you do calculate that out, so often, even though a guy will have a just total testosterone of 400 or 500, when you do the calculated free, he's not in the optimal range. So that's very important to do. And then it comes down to the same thing. Are you eating well? Are you exercising? Are you sleeping? Are you doing all the things that will promote a healthier testosterone? And then we can replace it so that we get you to really those optimal ranges.
Mhm. Yes, I think it's so important to look at. And other thought was in the role of peptides and growth hormone. I know
Mhm.
there's a lot of people that take injections, growth hormone. Do you find
Yeah.
any of that ever useful or not useful?
Yeah, I like sermorelin, which is sort of a secretagogue for growth hormone. So it's not directly growth hormone. I think there's some question as to the safety of using growth hormone, whether it's in,
Mhm.
the diabetes or cancer risk and that. So I'm more comfortable with the peptide sermorelin stimulating growth hormone a little bit. So IGF-1 levels can go up, a little bit off and on as you do the injection. And it can help with sleep. It can help with lean body mass, about 10%. People heal better. They feel just more vibrant. So I'm a fan of sermorelin for sure as one of the peptides.
Hmm. And then we talked a little bit about gut health, but as I know there's a lot of the estrogen in your gut bacteria. Have you researched
Yeah.
that area?
Yeah. Well, we know that the estrogen, when it goes down, some of the vital bacteria that are in the genitourinary tract area get affected. And then that's why women start having more urinary tract infections as they become menopausal. And
Hmm.
so gut balancing is very important, but again, it's that chicken or the egg. It's a combination. The estrogen is affecting the microbiome. The microbiome is then changing, and
Hmm.
you have to do both.
Yeah. I know Dr. William Davis has his new probiotic that has for women's vagina health of getting the right
Hmm.
bacteria in there. So
Yeah.
I talked to him again next week. But they sent me a sample that you can make it into his probiotic super gut yogurt, but you can add the different bacteria strains that actually help female
Yeah.
areas.
I'm just not sure, all of depending upon the estrogen level of a woman, if she's going to be able to maintain those
Mm-hmm.
probiotics that you're taking because the acidity changes.
Mm-hmm.
in the vagina. So you may be
Mm.
replacing them, but they may not be staying around as long
Staying.
as you'd like.
You'd
So
have
that's
to,
where the balancing comes in.
yeah, keep doing it.
Yeah.
Hmm. All right. So going back to original conversation of pickleball, because I know it's such a
Oh yeah.
popular sport now.
Yes.
How
Yes.
do people, when you hear people struggling with weight gain and they're doing pickleball, and me from the fitness background side, think, okay, it's not, I don't know what type of intensity it is. Do you find that the hormones are helping people in the combination of everything? What kind of solutions do you find for people that are pickleball players struggling with these changes as they age?
Well, pickleball is certainly not, running a marathon, and it's not sprint training. It's not a hit protocol. It's probably more like a zone two for a lot of people, but that could be determined with your testing. But you can do it for like, 2 to 3 hours, and you keep your heart rate up, maybe at 130, 125, 100, so I think it's good maintenance, but it certainly is not in lieu of a good exercise program and resistance training. You still need
Mm.
to do those with the pickleball.
Do you find more people in pickleball? It's not related to hormones, but do you find them trying to lift weights more? I know you talked to Larry
Yeah.
about the blood flow restrictive bands, but do you find
Hmm.
that because I guess it is related altogether because it's the hormones we're trying to improve and improve body composition. But I think so much people playing pickleball and being active, they're not seeing the changes they want, but maybe they're not adding strength training or don't want to do the work of strength training.
Yeah. Well, yeah, again, it really depends on who they've been interfacing with, talking to, if they go to a doctor that just is a disease model doctor, and they're lucky enough to get estrogen, progesterone. That provider doesn't necessarily talk about, well, you really need to add strength training to this, and you need to get your stretching. But I find the pickleball community as a whole are your, I was going to say older, but the average age now is 35, but there's a good 30 to 40% over 55 that are playing. So there's a good number of older adults playing pickleball, and they're motivated to stay strong, maintain stamina, and not get injured. So with that in mind, they do tend to be, from my experience, more likely to be maybe doing yoga, Pilates, and doing some weights, because they get how it all works together, but not all of them.
Mhm. So, what type of success have you had with clients or your patients since you opened your practice based on the motivation from these pickleball players making comments to you, their struggles?
Well, I've only been open like a month and a
Month?
half,
Yeah.
but I mean, I have 25 years of treating patients with bioidentical hormone therapy, so it's not new. But with this pickleball community, definitely feeling more stamina and feeling a little stronger and more
Mhm.
motivated to do the strength training and to do the things that are going to keep them thriving as they go through this future decades. They're motivated.
Yeah. So, what's one thing someone should do middle age to take ownership of their health today to be their best self in the future and improve how they age? What would you
Hmm.
want them to look at first?
Well, if they read the book, The Truth About Sex Hormones, I think it would answer a lot of the questions as to
Hmm.
the fact that the hormones are there to not only enhance quality of life, but also to prevent these chronic diseases that about 80% of us eventually die from, and namely heart disease, metabolic diseases like diabetes, neurodegenerative conditions like Alzheimer's being the main one, and cancers.
Yeah, the cognitive health part is a scary area for me. I feel that I just I know there's a conference in San Diego next week actually, and they're
Yeah.
focusing one day of the 4-day conference of Parkinson's research. And I feel that the cognitive health is really something I wish we would all do something now for it and help
Yeah.
improve that because
Well,
that seems to be more common.
I tell people to check their EPOE, to know, what do their alleles, what does your genetic makeup look like? And it doesn't mean because you have two E4s that you're going to get Alzheimer's. But
Mhm.
if you know what your risk factors are, is there family history? Do you
Mhm.
have the EPOE gene? Then maybe you'll be more motivated to control stress, get enough sleep, make sure you're getting exercise, and perhaps supplements like the omega 3s, getting your gut balanced and things like that, doing what you
Mhm.
can do.
Yeah, I think there's another topic, but a lot of research on lion's mane and the omega-3 fatty
Yeah,
acids for sure, and
yeah.
creatine research just
Yeah,
keeps coming out.
creatine. Yeah, that's a good one.
Yeah.
Yeah, there's not a lot of great data on a lot of supplements because it's hard to study, but those that
Hmm.
you mentioned are good ones for sure.
Yeah, I think those are something I'm working on making sure to take and combining sauna into my routine because the
Yes.
brain BDNF, brain drive neural factor for sauna 4 times a week, 20 minutes is always
Yeah. Well,
shown in
getting
research.
inflammation down, right? I mean,
Mhm.
inflammation seems to be at the root of a lot of these conditions.
Yes, yes, for sure. I know that. So when people want to get your book and learn more about your program, where do they want to go?
Just go to Amazon. It's available audio and ebook as well as a real book.
Did you do the audio version yourself?
Yeah. No, I actually had it's an AI, but it was done pretty
Oh,
well. I don't like my
wow.
voice so much.
I haven't heard of AI doing that. I guess not
Yeah,
surprised.
I thought it was it sounded relatively pleasant and not too robotic, I thought.
Well, that's good. Well, I find that sometimes easier because it's similar to listening to a podcast while you're driving or a book on
Yeah,
tape or modern day
right.
book on tape.
Yeah. It's
What does it?
efficient. Yeah.
Good for you. And then if people live in San Diego, you work
We also do
in place.
telemedicine, so
Okay.
I'm only licensed presently in California, but I'm getting licensed in 10 other states in the next few months. So, now with telemedicine, I mean, people live wherever, right?
Yeah.
And you could and talk to them and see them. And I usually get blood through LabCorp, and they're all over the United States, so
Mhm.
that's pretty easy.
It's funny that you have to be licensed in different states. Do you think that will change? Like,
I
why do
hope
you need
so. It
that?
doesn't really make sense, does it? I
No,
know.
I just thought of that because I hear that other doctors, I'm like, wait, why do you have to be licensed in different states to give something that's natural to them?
Well, to
Yeah.
prescribe the hormones, you do have to be licensed. I mean, I could talk to anybody, in any state. I'm not billing insurance, so that I could do, but to actually prescribe, I think is where it gets tight.
Hmm. Yeah. Hopefully that changes. Well, it sounds
Yeah.
that everyone needs hormone replacement. Would you say anyone that shouldn't have any hormones, take any hormones?
That's a good question. There definitely is a lot of research and needed still to really make sure that, if you actually have breast cancer, but you have hot flashes and night sweats, if you were an estrogen negative, type of breast cancer, would you be able to take estrogen and not worry? So that has to
Mm-hmm.
be teased out. But I can say that studies have looked at giving vaginal estrogen for the genitourinary syndrome of menopause, namely the pain with intercourse, the dryness, the UTIs, incontinence,
Mm-hmm.
and that is completely safe in breast cancer. So we don't have any question there. But family history of breast cancer, not so much thought to be absolute contraindication. But I always tell patients, here's the data. This is what we've learned. This is what we believe. You have to make the ultimate decision, what feels right for you.
And for men, is there a man no pause, do you feel that they go
Yeah, we
through?
call it andropause, and andro being male and pause, and that's sort of the equivalent for women. I mean, it's the
For
equivalent to
men.
menopause. Yeah.
Hmm. Yeah, I always call it menopause and but then I never can say
But see,
menopause.
then it should be woman pause, right? Not
Yeah,
menopause.
menopause. Yeah, so funny. So I think it's such great information to share with everyone and share with your friends and
Mhm.
to get the importance of why most of us should be taking some hormones, that it's not going to cause you cancer. So,
Right,
get your research, work with someone as yourself that can help people figure out what to do and how much to take, and that you need to be on ongoing care to make sure you're not getting too
right.
much and get them
Things
out of balance.
change. Hmm.
Yeah. So
Yeah, and
keeping
it's
the
just
liver
so
healthy.
important. I really stress in the book the prevention of these chronic diseases because so
Mhm.
often people go, well, I don't have any symptoms. I don't have hot flashes or
Mhm.
night sweats, so I don't
Yeah.
need the hormones.
Yeah.
And they're missing the boat, and if they get osteoporosis, Now you got to be on a medication, that has side effects, or you're at
Yeah.
risk of breaking a hip and dying. I mean, they're real repercussions to not going on the hormones as a rule.
Mhm. Yes. Well, thank you so much for getting this information out there and following your passion and getting out of
Yeah.
retirement so you're not just getting to play pickleball all day and live the
No, well,
retirement life.
you can only play so much pickleball, you need to
Yeah.
balance it out. It's got to be
Yeah, I know.
balanced.
That's how people get injured, right? Those pickleball injuries are
Exactly.
increasing.
Yep. Well, more people are going into it every day that are older, so it's bound to happen.
It's all about balance. Yes.
Exactly.
Amazing. Well, we'll make sure we put all the links below. And if you guys have questions that are listening, let us know. And I know where Dr. Janette is, so I can get her back on the
Yep.
show to follow up. So thanks,
All
Janette.
right, great. Thank you.